All right. I'm seeing live on YouTube. Are you seeing that, Megan?
Yeah, the little bar is running, but you're really close.
Okay. And do you need record? Do you need to push record before I start? Are you good?
Hmm.
Are we good to go, or do we need
You're
to?
good. No, you're good.
Thank you, Megan. Megan's done a great job from the backside setting all this up for us, and just want to welcome everybody to the South Central Kansas call. This will be our time slot every week from 1:30. This first call will be laying down a little bit of the foundation and the rhythm for the future calls. I appreciate everybody who's joining in here to participate. They got pretty late notice on this. This is something we've stood up in a very short amount of time, and we're grateful to our governor and speaker and Senate president for putting politics aside and supporting this project and helping endorse it. The goal of these and the purpose of these calls is so that you can hear what's going on in your regional healthcare system. Healthcare systems move regionally, and right now you can get data from a state level. You can get data from a county, but it's difficult to piece together what's going on in your region. And so we'll have dashboards, but the goal of the guests that we have on here will be that they'll be able to add color to that and help translate it outside of the healthcare world and into your world. The intended audience of this is really anybody who's interested in what's going on in their region. There's a lot of elected officials that have to make decisions based on what's the status of their region is. But there's people that are business owners or community leaders or parents or people caring for aging adults that all need the information and want it. So if you know of people that are looking for this, our goal will be to keep these calls for 15 to 25 minutes at the most, just to get you a snapshot for this week, what's going on. And as you pay attention week to week, you'll start to get a sense of trends and what the hot topics are for your region and what's going on right now in South Central Kansas. We'll start with a public health perspective, where we'll hear about testing and positivity rates and things like that. KDHE is going to start putting together a dashboard for us that we'll have available next week. And then we'll pivot from there into the hospital system. And the Hospital Association of Kansas has put together dashboards that'll be referenced so you can know how many staffed ICU beds there are, where we're having staffing shortages. And then beginning next week, we'll also have a dashboard from Mission Control, which is the software that's helping transfer patients, in and around the system, so we can have an idea of where that's at. And we'll have them on as a special guest next week. And then I'll end every call with a bright spot that's just catching someone doing something right, bringing kindness and goodness into an uncertain and difficult time, because a lot of the subject matter on these calls will be heavy. Now, you can watch these on YouTube. You can also encourage you to go to the website. It is covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. And you can sign up to get an email of this after it happens and have the dashboards attached and this conversation for you, so you can know what's going on in your region. We've divided the regions along the lines of the Healthcare Coalition map, which is used by Emergency Management, KDHE, and is pretty close to how the healthcare systems move. And that map is also on that website I referenced earlier. We're not going to have time for live Q&As. So what we're encouraging you to do is email us at ksregionalreport@gmail.com, ksregionalreport@gmail.com. Things you want. Just tell us you're talking about the South Central Kansas region, and I'll make sure we try and address it on next week's call, so that we can make sure we're talking about what's important to you. All right. There's the setup and what we have going on. And now I'd just like to turn it over to, and there's 7 of these in a row for the region. So if there's other regions you want to pay attention to, you can sign up for those as well. You are currently listening to South Central Kansas. And I'd like to kick it over to Seth Conkle, who's been contracted in. He had worked in public health for a long time and is now right in the middle of it as a contractor. And just to give the perspective from the South Central region, particularly Sedgwick County, where I know he's been stationed. Seth, can you give us a little perspective from the public health side?
Yeah, absolutely. Thanks, John. Yeah, so my background is in public health, emergency preparedness and response, and epidemiology for several years, starting in 2002 through 2012. And I think being pulled back into this for the COVID response has been definitely a chore for all people in public health, and I think South Central Kansas has definitely risen to the challenge. I think it's an interesting, South Central Kansas has always had a little bit of an interesting perspective because our counties are so diverse. So you have Sedgwick County and the Wichita metro area that pull in a couple other counties, and their large population, and then the rest of the counties in the region are very small. So I think what we're seeing throughout the region is drastically different in terms of just the magnitude of what the response efforts look like. So I think that the biggest thing is to always look back at what your county is doing. And we've seen that throughout the course of this response, that counties do have the permission and the ability to put into place specific public health practices within their county. So unfortunately, what that means, though, is that COVID doesn't know the boundaries that those counties respond to. And that's why I think, John, has been an important that the team, you and the team leading this, are trying to look at this at a regional perspective. Because for the most part, the commerce always happens, and even the hospital feeds always happen for the most part in that regional pattern. So we are seeing a very drastic number of different variations or different levels of the positivity rate, as low as about 4.4% in one of our counties, up to about 12.8% currently in some of the other counties, and even higher. So I think that the reason that from a public health perspective, that getting that positivity rate down is important is because a lot of factors are being determined by that. School attendance is being determined in many cases by that. Long-term care facilities from national guidelines are required to follow those for whether or not how many staff they're required to have, whether or not you can go in and visit loved ones. I know that's been a traumatic piece for a lot of not only families who have loved ones in long-term care facilities, but also those that are in the facility themselves and then the staff that are there to support them, that with high enough rates, they have to lock down or limit the number of people that have been able to be in those facilities to visit their loved ones. So I think especially as we head into the holidays, we don't want anybody to be separated from their loved ones. And I think that's one of the reasons that we'd like to see that those rates go down. I'm going to share my screen here in just a moment. But before I do that, I think the other piece is just to look at what you as an individual can do. If that means staying home a little bit longer, we've heard it, the social distancing, wear the mask. Again, there's science behind that to determine what those were. That was not just a number that was made up from the CDC when this began. 6 feet is that ideal distance for non-household contacts. Wear a mask when you're in public to prevent yourself and others. I know that the intention behind that is to prevent others, but I think it can definitely help prevent you from being exposed unknowingly to the disease. Let's see if I can share my screen. If our host can give me the permission, I will share. If not, I can just kind of walk you through. I think what I wanted to walk through the most was kind of that case rate since May. And I just pulled up Sedgwick County because they do have a dashboard on their website. And so it's, I think, definitely
ability now, Seth, to share your screen. I just saw
okay,
it.
Perfect.
And I'm going to try and limit it to about 2 more minutes.
Okay, I'm about done. I'm going to show the screen and then I'm done. So you can see back from March, when we had those stay-at-home orders in place throughout most of the county and the states, actually at the state level at that point. And then as we kind of continue along, back into the end of November, where we, at least in Sedgwick County, we're at the highest percentage that they've been at throughout the course. And now it's kind of trending downwards. I think that we're going to continue to see this until vaccine becomes available. And I think it's also important to note that this is not going to be stopped by one person, one entity. This is really going to be us as a community together. And we can't do it without everybody in the region and within the state to help us do that. So I look forward to continuing these calls in the next couple of weeks and so forth, and would love to be able to answer any questions or pass that off to other public health professionals who will be joining over the course of these calls in future weeks. So John, I think that's all I have.
Thank you, Seth. And when you say that you think this is what we'll see for the duration until a vaccine, do you mean the high positivity rate, or do you mean the decline that we've seen since the middle of November?
I think personally, I think we're going to continue to see a higher level as long as people are not following the recommended guidelines that are, again, those are science-based, wear a mask, social distance. Again, kind of like a snowstorm, we hear this, and I feel like we all follow the rules, or not the rules, but the recommendations. When it's snowing and there's 6 inches of snow on the ground, you stay home. And I understand this has maybe been 6 to 9 months of that. But again, doing what you can as an individual to limit your exposure and the exposure of others is definitely critical. And then if you do get exposed, get tested. I think we've seen a drastic decrease in the amount of time it takes to get those results back. And that helps then prevent you or others from spreading the disease.
And the reason we start with, thank you, Seth, the reason we start with public health is the testing and the positivity rate are the first leading indicators for what DD and the hospital systems will see, in the following weeks. And so thank you, Seth, for what you had to say. And now I'd like to kick it over to DD. Is it dual? Did I say that correct?
You did.
Yeah.
You nailed it.
To give a perspective from the hospitals.
Thanks, John. Again, my name is Dee Dee Duell, and I am with Ascension Via Christi. And I'm happy to be able to join this effort. And I will be our regional coordinator. And so what I'm going to be sharing with you today is the summary of the dashboard that John indicated earlier that comes from the Kansas Hospital Association. And they are putting these dashboards, pulling this information together on a regional basis. And that information those statistics are based on the most recent period that is from December 9 through yesterday, the 14th. And that information is reported by hospitals into the National Health and Human Services teletracking system. So that's where the data is pulled from, and they pull it together and aggregate it on a regional basis. So I'm going to be noting some of that information here. So as of yesterday, the total cases in the South Central Kansas region totaled 57,795. Now that actually is showing a slight decrease in new cases over the previous week. So it's actually about a 7%, showing a slight decrease of about 7%. So, at the end of October through most of November, we saw quite a rapid rise in cases and hospitalizations. And since the end of November, we've actually kind of seen a slight plateau in that number of cases. So this could possibly indicate that the increase in awareness from the statewide efforts that have been taken by many groups, to take measures to slow the spread. So here are just a few more details that come from that dashboard update. So as of yesterday, our region reported 313 confirmed hospital of COVID patients, with 361 hospitalized, confirmed, or suspected. And 105 of those were actually in ICU beds. And the reported deaths as of yesterday from the region are a total of 25. The overall staffed ICU beds stand at 278, and 148 of those are occupied by non-COVID patients, in addition to those 105 COVID patients at the time of this update. It's important to note, I think, on the ICU bed availability, that it's fairly fluid on a daily basis, especially in the larger hospitals, because as patient acuity occurs, in addition to the patient discharges, those numbers can change quite a bit throughout a day, from morning to afternoon, throughout the evening.
Yeah, and let me highlight that point too, Dee Dee, just in the sense of as I've gotten to know this as a non-healthcare person, there was one Friday where I saw that we had 13 ICU beds available in the South Central region on a Friday, and by Monday it was at over 130, and on Wednesday it was at 30. And so those do move. Hospitals are dynamic and really living organisms in their own right. They're not static in that way. So just important to realize these are a snapshot. And generally, when it comes to the hospitals, just help people understand if there's issues, it usually revolves around one of three things, which is stuff, staff, or space. Stuff was the issue in April, which was around PPE. Right now, it's around staff is creating a lot of the limiting factors. So go ahead, Dee Dee. I just wanted to add that color.
Thank you for the segue, because that was perfect. And my next point was going to be on staffing. And I guess in addition to that, the ventilator availability has really never been an issue from the start, really, thankfully. And so, but as it relates to staffing, information that was reported over the past week again, this report showed that 53% of the hospitals in our region were anticipating staffing shortages this week. Now, if you compare that, it's actually a higher percentage in comparison to the rest of the state, which reported about a 40% expected staffing shortage. So what the staffing issue can be quite a challenge, especially for the smaller hospitals, because they don't really have a deep pool to pull from when they need to cover for staff. And they also are having quite a challenge finding contracted staff if they need to try to get contracted staff to come in, because the high demand, there's just such a high demand everywhere, you just can't even find them. So that can be quite a bit of a challenge, and those staffing shortages directly impact how many patients that you're going to be able to care for at any given point in time. So I think one final note that I would like to share today from just other information is that overall, most hospitals are seeing lower ED volumes overall across.
That's emergency room as far as translation goes.
Our emergency room volumes overall. And this actually is fairly concerning for hospitals and providers, because they don't want people to avoid care out of fear to come to the local hospital or even to go into the clinic. And so that is something that they are keeping hyper focused on, is those lower ED volumes, because down the line that may indicate something much more serious down the line.
They call that the secondary pandemic, when people actually they have strokes and heart attacks and do not go seek care because they're afraid of the hospital setting. And generally, the COVID is not being contracted to the hospital. So if you need emergency care, it's important to get in there. The contraction of COVID is happening out in the community on the day-to-day basis, much more than in a clinical setting like a hospital. So just really encourage people that they're having other health issues that might be avoiding getting care to go in. That's a real important point. Thanks for bringing that up.
Absolutely, it is. And hospitals everywhere, the infection control measures that are taken and required are just impeccable. And so there should be no hesitation or concern about that. That's really most of what I wanted to share with you. And actually, I'd like to introduce the next presenter for us that I was able to get pulled in today, and thankfully on a short notice. We'd like to also, provide just a glimpse into some of the happenings from the front line of hospitals in our region on the COVID-19 response. So today, I was able to get Dr. Stacy DeShiel to join us. Dr. DeShiel is a family medicine physician in Lyons, Kansas, at Hospital District Number 1 in Rice County in Lyons. And she's actually going to share kind of that boots on the ground perspective with us briefly. So Dr. DeShiel, I'll turn it over to you.
Great. Thank you, Dee Dee. So this is an opportunity for me to share just what life looks like on the day-to-day for us in rural America. Like Dee Dee said, I'm a family physician. I practice full scope medicine, which means I kind of do a little bit of everything. So the story that I'm going to share has to do with one of my hats that I wear, which is covering the emergency room. I also am our medical director for emergency management. And so wear that hat. I do some hospice work and have really seen on that side, just all of our admissions are skyrocketing, and so many of our nursing home patients that may have been ailing in one way or another, but are passing quickly, and just really so much loss there on that side. The story that I wanted to share is one that is kind of a great example of much of what has already been addressed here. This gentleman is a 68-year-old male who had really no major medical conditions. He didn't go to the hospital a whole lot, or the doctor a whole lot, but he didn't take any regular medicines. He was still working full time, and he delayed seeking care, whether that was pandemic concern or just that kind of rural America sort of mentality of I can just tough this out and get better. He went to an urgent care in Great Bend, which is about 45 minutes from us, because that is where rapid testing is available. We don't have rapid testing availability on the weekends anywhere in our county. He tested positive and then also had a significant oxygen requirement. And so the provider at that facility wanted him to go directly to Great Bend to the emergency room. He wanted to be at his small town rural hospital where he was comfortable. And so we got a phone call from that provider saying, hey, I've got this patient that is headed your way. He needs oxygen now. So he drove to our facility. We initially evaluated him, and he indeed had a pretty significant oxygen requirement. He also had an irregular heart rhythm, atrial fibrillation, which was probably also caused from COVID, from the stress on his body from COVID. So this right off the bat is a gentleman that we would, under normal circumstances, like to transfer on to a higher level facility. Our facility doesn't have any ICU beds. There are four family physicians for our entire county. We have no specialists other than a part-time general surgeon, but there were no beds available. And so I had the opportunity to speak with a hospitalist at Salina Regional. I kind of just discussed my plan of care with him and made sure that we were doing all that we could do for him at our facility, and then admitted him until a bed became available. I do feel like, so one of the other hats I'm wearing right now is I'm the physician head of our hospital COVID committee, and so have been just in the thick of it there with policies and preparations and all of that. I do feel like we have done a good job with that for a hospital of our size. And so I had the medications for him that I needed. We had the policies and protocols in place, but this type of patient it just really stretches our staff, if nothing else. I received phone calls on this gentleman all night long. His oxygen needs continued to increase. We had him up to kind of the maximum level of support that we could provide in our facility. And so that next morning, I started making phone calls again. This is an opportunity to kind of put a plug in for the life save mission control sort of system. We have what we call the blue phone, which is a phone that goes directly to that line. And they were the ones that really found the bed for me. We ended up there was an ICU bed available, I believe one at that moment at St. Francis in Topeka. And I think this is where, just putting things in perspective is important. I've practiced here for 10 years. I have never transferred a patient to Topeka. That's just outside of our region. It's outside of, we pass by a lot of hospitals between us and Topeka. So we were thankful for a bed. Next followed was a conversation with our EMS staff. Could they be out of the county with their ambulance and their crew for a 3-hour drive there and the time it takes to get that patient inside, and then a 3-hour drive back? And the answer was no. We couldn't leave the rest of our county without an ambulance crew. So this patient ended up being transferred by a fixed wing airplane. And again, this is something that we don't do because it's just not the best care. So what that looked like is a LifeSave airplane landed at our small airport. Our ambulance crew went out and picked up their flight team, who came back to our hospital, loaded this patient, took him back to the airport, loaded him onto the plane, flew him to Topeka to an airport because an airplane can't land on the roof of the hospital. He was met there by another ambulance, which then took him to St. Francis in Topeka. That is a long, difficult trip for a patient that is already struggling. And that, I think, that's what we're dealing with right now, is these stories that are just so far outside of the norm. So then the small town piece of the story, I got updates on this gentleman through my through my church prayer chain, because his family attends my church. And I got the updates that he had been intubated, and then I got the updates that he had been moved to comfort care. And then I learned this morning from my staff here at the clinic that he passed away. So my first patient of the day today mentioned, not knowing at all that I was involved with the case, hey, we lost one of our own to COVID this week, didn't we? So it is just an unprecedented time for us. It is asking things of our rural healthcare systems that are so far outside of normal for us. And then it's caring for those that we know, our neighbors and our church members, and that sort of thing. I think we are definitely feeling the staffing shortages that were noted. We have 3 laboratory technicians. And so when one tests positive and the other 2 have been exposed, that is literally incapacitating for us and can be just really significant. So I know I have heard, I try to kind of touch base with Facebook and social media occasionally just to know what information is being shared and be able to hopefully share some factual scientific information. And I know I am hearing these reports that say, well, the KDHE dashboard says that there are, I actually just looked just a little bit ago, 32% of our ICU beds are available, and we have 1,800 inpatient beds available. And so the public's perception continues to be one of kind of question and doubt of, we're hearing this, but then we're hearing that. So one of the things I hope this regional group can do is to try to get some better numbers out there, and numbers that better represent the situation that we are currently living on a day-by-day basis here.
Thank you, doctor, so much. And we're running out of time here. Dee Dee, did you have something you need to say? Or I saw you leaning. Okay. You're absolutely, your story you shared is heartbreaking, and your level of care is so beautiful. Just so you know, the care that you have for this patient. But this is what we're running into, and you highlighted the issues from a boots on the ground perspective very well. The dashboard that Dee Dee was talking about is attached to this video. Showed 25 staffed ICU beds. That was a moment in time. But hospitals go on, it's called deferral. Is that correct, Dee Dee, or deferment?
Diversion.
Diversion. third time's the charm. And that means that they're not accepting outside patients. And that's issue that you would have run into. And so instead of being able to move them from Great Bend to Hutch or sorry, from Lyons to Hutch or to Hayes or Salina or Wichita, you're taking them all the way to Topeka and having to fly in an airplane. And generally, the further you have to go, especially not being able to be in an ambulance, the worse off you're going to be when you get there. And so the issues are real. We're on the edge. That was really a theme from the KC Metro call, is that we're on the edge. And if the numbers spike, if we do get a Thanksgiving or holiday or flu bounce, it can really start getting even more serious more often than what we ran into, where it could take so long to find the proper care in the bed. So thank you for what you're doing. Everybody, thank you. We'll be here. If you have comments or questions, it's ksregionalreport@gmail.com, ksregionalreport@gmail.com. Our bright spot this week, just really quick, a Wichita church is creating quarantine kits for 17 families who immigrated to Kansas from the Congo and attend their church. The goal was to make staying in quarantine more doable and necessary. I have 6 kids under 11. We've been in quarantine for 2 weeks, and it is tough. House gets smaller every day. So just neat to see people leaning in, trying to bring goodness and kindness and light into the world in such uncertain times. So thank you all for your time. Thank you for being so vulnerable and sharing that story. It highlights what's going on out there, not just in the big cities, but in rural medicine also, as our systems try and work together to solve this. So everybody, tune in the same time next week for the South Central Update. Please tell people you know that would be interested in this information, and we'll have even more dashboards and information for you next week. Everybody, thanks for joining in. Seth, Dee Dee, Doctor, thank you guys.